The Rood approach was a neurotherapeutic theory created by Margaret Rood, who was both an occupational therapist and a physical therapist. Her overall goal behind her theory was that sensory stimulation can elicit specific motor responses. Basic assumptions from this theory include that normal muscle tone is a prerequisite to movement. Treatment begins at the developmental level of functioning. Motivation enhances purposeful movement, and repetition is necessary for re-education of muscular responses.
Neural warmth is an inhibitory technique that has been successful for relaxation. The next is manual pressure. In the hand, a hard cone with a tapered end toward the thumb side inhibits the flexors to be used. This is specifically helpful with spastic or tight muscles. The next to last proprioceptive technique is light joint compression. This inhibits spastic muscles around a joint to alleviate pain and offset muscle imbalance. The 10th and last proprioceptive technique is positioning hypertonic extremities in the elongated position for various periods. So, Rood's big thing was the powerful effect sensory stimulation can have on patients with neurologic dysfunction.
Okay, so the otogenic patterns are as follows. The supine withdrawal, the rollover, the pivot prone, the neck co-contraction, on elbows, all fours, static standing, and walking. These are in a specific order in order for the movements to be mastered to go on to the next movement. With the supine withdrawal, it's just a basic protective position for the person. The rollover is going to be going towards a sideline, which is preparatory in order for mobility in your upper extremities and lower extremities. And pivot prone follows that, which is basically full extension of your body while laying down on your stomach. Neck co-contraction is used to be able to raise your head up against gravity. And on elbows is you're still lying on your stomach, but you're propped up on your elbows, and it allows for your weight to be able to shift from side to side. After that, you go to all fours, which just prepares the body for weight shift in all directions, forward, backward, side to side, basically like in a basic crawl position. From there, you move to static standing, which is just standing upright on both feet and allows for equal weight distribution. And then from there, you progress to walking, which combines all the skill and mobility and stability required for all of the patterns.
The OT treatment process begins with occupational therapist evaluation, you know what I'm saying? So the evaluation identifies the patient's level of motor development. Treatment starts at this level and is directed towards progressing the individual along the developmental continuum. Initially, if severe neurological damage is present, the patient may need to begin with reflexive movement. The occupational therapist then progresses the patient along the ontogenic developmental patterns. Excuse me. Sensory stimulation can reinforce these patterns and can be used to inhibit or facilitate specific muscle activity as needed. The sensory stimulation techniques described are used primarily to prepare a patient for purposeful activities. So, you know what I'm saying? So yeah, that's it.
The role of the OTA is to provide continuous and proprioceptive stimulation and consider ontogenic movements patterns when positioning for activities.